India's latest health survey is sending out a clear warning. The country is improving on child nutrition, maternal care, immunization, but a new crisis is rising fast: obesity and diabetes. So, according to the data that the government has shared, more Indians are now overweight, obese, battling high blood sugar, making lifestyle disease one of India's biggest emerging public health challenges.
That's not all, Ahana. The National Family Health Survey 6 has conducted a report, a survey in 2023 and 2024, and it found a very sharp increase in obesity and even sugar levels across India. Women aged between 15 and 49 who are overweight or obese rose from 24% to 30.7%, while men increased from 22.9% to 27.3%. High blood sugar or diabetes medication use also rose from 13.5% to 17.8% among women and from 15.6% to 20.9% among men.
Yes, Deepak, the survey also shows that India is now facing a double burden. On one side, child stunning and malnutrition indicators are improving. On the other, obesity, diabetes and lifestyle-linked diseases are rising quickly. This means India's health challenge is no longer about undernutrition but also about excess weight, poor diets and lifestyle choices.
That's right, Ahana, and obesity and diabetes are fast becoming India's new health challenge because they are spreading across age groups. It's not sparing the young ones or old ones. It is prominent across age groups, gender groups, and even both urban and rural areas as well. So the urban India burden, now is shifting to rural India as well because the numbers are also rising in rural India. And the concern is that obesity and high blood sugar are major risk factors for heart disease, stroke, long-term chronic diseases. And the survey has also made one thing very clear, Ahana, that India now needs prevention, lifestyle correction, and also balanced nutrition. And that too at a very, very early phase. Early screening at the center of public health policy is the need of the hour. And to help us understand what really is happening across the country, we have Dr. Nitin Kapoor, Honorary Secretary of South Asian Obesity Forum and Head of Department of Endocrinology, Diabetes and Metabolism of Christian Medical College. And we also have Jyoti Dev Kesavdev, Director of Jyoti Dev's Diabetes Research Center. A very good afternoon to you, gentlemen. First, let me go to Dr. Nitin Kapoor. Dr. Nitin Kapoor, how do you look at the surge in obesity and diabetes cases? Because this is something that's happening at a very, very alarming level, not just in urban India, but also now spreading to rural India.
I completely agree, but what I would say is this is not new. If we look at the National Health Survey data that came from NFHS-4 versus 5, and now that we're talking of 6, there was a similar increase at that time as well. So it has been increasing. It has been showing us these trends. When you look at data from NFHS-4, 35 to 40% of the Indian population was overweight and obese, going on to early 40s just within a span of 5 years, and now we have even more startling figures. So I think this has been happening over the last 15 years gradually, and it's not very new, but yes, needs full attention, and glad that you're bringing this up.
My question to Jodhdev, sir. Sir, why are lifestyle diseases still rising despite greater awareness about health and fitness now? Everyone is taking protein powders, everyone is watching Instagram for dieting, but why are diseases like obesity and diabetes still increasing in India?
I think the exact reason is the general public is not aware of obesity. They are not aware of what exactly means a person is overweight. Because if you look at people who are dieting, exercising and reducing the weight, or on anti-obesity medications and reducing the body weight, then the society is preventing them from retaining the lost body weight. They keep on criticizing. They will ask, oh, what happened to you? Have you developed a cancer? Are you having uncontrolled diabetes? As if losing weight is a crime. So the stigma is actually with losing the weight. So the society need to be taught that you have to remain lean. The society need to be lean. Because earlier, we used to define normal as something which is seen in the majority. But now, almost 40% of the population is now either overweight or obese. I still remember earlier, historically, when blood pressure used to be defined, people thought that BP is something normal. Because when you are getting stressed, then there is an increase in the blood pressure, and that is considered normal. And then only later we found that increase in the blood pressure can kill a person. They can develop a heart attack or a stroke. Similarly, the society should be aware that not only the children, the parents at home, the grandparents at home should be aware of the fact that if somebody is overweight or obese, they are going to develop more than 300 illnesses. The illnesses that we are discussing now, they are only tip of the iceberg. You are forgetting cancer. This is attributed not only diabetes or hypertension or kidney disease. More than 30 cancers are closely related to obesity. And if that fearful, because fearful thought should be there in the society. So we have to keep on educating the children. I am representing the central RSSDI as an executive committee member, and now we have decided to focus on children in the schools and also pupils in the colleges, and that is where we need to start.
Sir, it's a very, very interesting point that you made. Let me go across to Dr. Kapoor. Dr. Kapoor, no amount of findings is really, important unless there is enforcement on ground zero. And when there is no enforcement or awareness, people will continue to order, junk food online. And it is so accessible now that, every time you order junk food online using these apps, then there is an alarming rate of surge in obesity as well as blood sugar levels. But people really don't care. So how do you change this mindset of the people?
Absolutely right. And I think that's one of the major causes, having food delivery at your fingertips, available all the time. But how do we address it is essentially to make sure that, having more awareness programs, making people understand that obesity is also a chronic disease, very similar to diabetes, hypertension. When we have diabetes, we have high blood sugar, and we give medications to reduce it, and it becomes normal. But we have to continue these medicines long term. And similarly, today, obesity is considered as a chronic disease, no longer just a simple choice of a patient of eating more and walking less, but it is biologically determined. It's not always in patients' hand. You need professional help to handle this. So the awareness part of this, and I very much concur with Dr. Jyotidev about targeting school children. And I think that's the main crux, where not only the children, but then there's a cascade effect to the teachers, to the parents, and to the society at large. So yes, bringing this health education to the school level is probably the best next step to target and curb the obesity rates that we are seeing.
Totally, sir. Agree with you. Society is responsible when it comes to minimizing lifestyle diseases. But Mr. Jyotidev, is India's healthcare system prepared for the coming diabetes and obesity epidemic?
We are getting prepared. As Dr. Nitin Kapoor said, because we work in same societies, and I completely agree with Nitin that we need to do more. And what the government has to do is the government has to partner with the public sector. There should be a public-private partnership. The government has to implement projects in the schools, in the colleges. And I have seen that when the children are obese, if we look at the same survey, we have seen that the childhood obesity below the age of 5 years is also, it is surprisingly, shockingly increasing when compared to the previous years. So what is happening? How can the children be blamed? The children are becoming obese because the parents are not aware of obesity, or the grandparents are not aware of how to feed the children. So the children cannot be blamed. So the government cannot be blamed, but the healthcare system needs some subtle changes, because in the medical college, even
No,
when the
sir, nobody is
doctor,
blaming the government. My question was, is our infrastructure ready for this epidemic? Are we ready to...
No, we are not ready. We are not ready for this epidemic. We need to get ready. We are not at all ready for this epidemic, because we need to probably be aware of the fact that obesity is a disease which lasts for a life, and obesity is a recurring disease, or obesity is a relapsing disease. And never forget the fact that at least 30% is genetically predetermined, but it can be modified. It can be modified with daily exercise, with diet, and the government need to probably focus on this aspect. Now the focus is not actually on obesity, but we need to focus on obesity. And even in the medical colleges, we are focusing on treating the acute illnesses, not preventing. So the doctors who are MBBS doctors or MD doctors or the super specialty doctors, all are trained for treating the acute illnesses. They are not trained for preventing the chronic illnesses, preventing the complications of chronic illnesses, and that focus also need to be shifted. So the government probably need to have subtle changes in the syllabus, and they need to have programs only for obesity. I still remember obesity is a grave problem in women compared to men in India. So women are more obese. And for preventing obesity, we need to implement strategies from 35 years onwards. So as early as 35 years, we need to probably measure the body composition analysis. We are only currently measuring the body mass index and the waist circumference. So more investigations are also required, because I have seen in our hospitals, when we measure the body composition analysis and show them, this is the percentage of visceral fat which is more. You have 15 kilograms more of fat in the body, this much muscle is lost, and that description and the pictures make sense.
You know, Mr. Jyoti Dev, you know what is very shocking? What is very shocking is that after getting all these tests done, the report, is thrown into a corner. Nobody really cares about, what steps need to be taken to tackle the kind of obesity problems they have. But let's also shift focus on men and also diabetes. Dr. Kapoor, 1 in 5 men are either having high blood sugar level or on diabetes, medication. So how alarming is this trend?
I think this is also something that needs a lot of recognition. We know diabetes as the silent killer, and we would know that somebody has diabetes only if we check it. If you look at our statistics, we realize that about 2/3 of the people who have diabetes in India don't even know that they have diabetes. So there's a lot of unawareness. There's a lot of screening that is required, because this is a silent disease. The symptoms come in much, much later. That's when most of the complications have already started to set in, and therefore this is definitely alarming. The message here I would like to say is that everybody above the age of 30, now even lower, should screen themselves whether they have high blood glucose or not, and if they don't have, they should still periodically screen every couple of years. So the age of screening has really come down in the last 15 to 20 years. What was 40, 30, and now even 25.
You were telling us about how, not ready is our public infrastructure. So what are the key cornerstones apart from changing syllabus and also education, revamp in colleges and schools? What are the other measures that will help and make sure that our healthcare infrastructure is battle ready to combat these upcoming epidemics?
To answer? Me to answer? Okay.
Yes.
So I will say that we should have technologies, because the young people are very much passionate with the use of technologies. The use of smartwatches, the devices which can measure the physical activity, the devices which can measure the sleep, because the duration of the sleep is also very important. The young people, many of them are not sleeping properly. So, 6 to 8 hours of sleep is critical, and many are getting only less than 5 hours of sleep. And the physical activity should be more than 150 minutes a week, including muscle strengthening exercises. So all these advices, once given, the doctor or the other, even the government, we can monitor the activity by remotely monitoring the smart devices they are using, because many people are now having the smartphones with them. So along with that, if they are using a smart wearable device, we can probably monitor their physicality, sleep, and so on. And then, as Nitin Kapoor said, screening should start. But the screening, if we are detecting overweight or obesity or blood glucose, because blood glucose is also rising in the younger population from 15 years onwards. So once it is diagnosed, what we have usually seen is, even if we are advising something as a treatment for them, they are not accepting it. Many times the parents are not accepting it, because they don't accept it as a disease, since it is set in at a very younger age group and there are absence of symptoms. So early screening is meant for not only prevention but also for treating the diseases, so that there is a scope for primary and secondary prevention. So we have to have an agenda, we have to have a strategy where we have to incorporate at least 20 parameters. This is very important because India is aging. So we'll have a geriatric population very soon. In the state where I am coming from, Kerala, it is close to 20% now. And if obesity, diabetes, and other lifestyle illnesses are not treated properly, it will add on to the disability and other multiple geriatric syndromes during the older age group. So we need to be very proactive in educating the public in having some public health strategies. And in Kerala state, we have even now the new government formed a geriatric department. That is the first time in India we have formed a geriatric department, and the major chunk will be treating the obesity and diabetes related complications.
Mr. Jyotidev, my follow-up question is from Dr. Kapoor. So, Dr. Kapoor, can India prevent a future healthcare burden? Because, we discussed already that this is a major epidemic, this is the next big thing, and a lot of urban and as well as rural people are suffering from diabetes and obesity. Do you think that we can take this burden?
I think we can definitely take steps to mitigate the effect. We cannot probably prevent it completely in the next coming years, but definitely a lot of work is being done by these big societies within India. A lot of healthcare professionals are involved, and a lot of good steps are being taken, be it media awareness, social awareness, busting myths related to both diabetes and obesity, talking to government officials, bringing out white papers, making sure insurement of sugar tax, making healthy food more available. There are a lot of steps happening in the last couple of months. We have attended a lot of such discussions, which are, showing some evidence of change, which is already beginning. So I would say it's not totally preventable, but definitely big steps are being taken and need to be taken more in the future as well.
Professor Jyotidev, we've seen a sharp rise in rural India. Why is this happening in rural India? Because we know already urban India is burdened with obesity and, diabetes cases. But why is it slowly creeping into our villages?
I think number one, the genetics remain the same. The eating habits are changing, and they are also more into the sedentary lifestyles. We have to probably attribute this to the food habits, because the food which is delicious and tasty, it is usually unhealthy food. And the food definitely is related to obesity, and obesity is related to multiple other illnesses. And once somebody is obese, they consider that this is a normal condition. So the problem with the rural area is somebody who is gaining weight, they see them as somebody who is healthy and with more energy. And somebody who is losing weight, they feel as if they are having malnutrition. So I still remember during my medical college days, malnutrition used to be marasmus and kwashiorkor, and that is not seen in India anymore. And now malnutrition is overweight and obesity. So there has been a transition in the definition of malnutrition that is happening even in the rural areas in India. So I think education is the most important. The critical part is educating people both in the rural and urban area. And when we are educating, we need to educate about what is the normal weight for the height of a person. And that, because even for children, the parents are having an image, and that image is that of a chubby child, and that image should go away. That should vanish, and they should be taught about what is the normal weight for the height, and when they are growing up, what should be the normal waist circumference. I think these two basics will help. These are the two very basics that can be taught from the fifth standard onwards. I'm sorry for the power cut here.
Oh, no worries, sir.
Yeah.
So, Dr. Kapoor, how strongly are obesity and diabetes linked to heart attacks and strokes?
There is a very direct correlation. If we talk of obesity alone, there's a 23% increased risk of developing a heart attack, similar risk with diabetes, and when both of them are together, the risk is further compounded. So definitely it leads on, and it's not often alone that obesity is present alone with diabetes. It also accompanies high blood pressure, high cholesterol, and all of these are individual risk factors that add on to the bigger risk of developing heart disease. What I also would like to emphasize, something which is very peculiar to our country, is that many times obesity would be hidden. I completely agree with what Dr. Jyoti they've said about measuring body composition analysis, because many times in the Indian BMI we may look thin, but we may have a lot of fat at the wrong area, in the visceral fat around the heart, and that is the real bad fat doing all the damage to our heart vessels. So yes, presence of comorbidities associated with diabetes and obesity, in addition to their independent contribution to heart disease, plus the excessive visceral fat, adds on to the risk several fold.
Professor Jyotidev, we've spoken about the disease, obesity and diabetes in length, but what's the way forward? What are the lifestyle changes that can have a huge impact, on these rising cases to curb them down?
I think the most important motivation for a person with obesity or with diabetes is monitoring and the actionable information which is obtained with monitoring. And this monitoring can be with the weighing machine, the monitoring can be with the glucometer, the monitoring can be with a continuous glucose monitoring sensor. And every time they are having a value, whether it is a weight or a glucose, if there is a telemedicine facility and an infrastructure available in the clinic or the hospital, they are getting treated or followed up. And if there is a multidisciplinary team supporting the person and the family, then they can guide the person on what to eat, what not to eat, what is the preferred physical activity, and what is the importance of having an exercise which is more than 30 minutes, what is the importance of having a muscle strengthening exercise, and this goes on. And this is an ongoing process. And if you can partner, and what I meant at the beginning is a connected ecosystem. When there is a connected ecosystem where there is a telemedicine facility available and the person is connected digitally to the hospital, when the person is connected with a virtual diabetes or obesity center and with wearable a couple of sensors, this can be a smartwatch with multiple sensors or a ring which is available, which can also monitor the heart rate, physical activity, and some of the clinical trials ongoing for even non-invasively measuring the blood glucose values. And these are the motivating factors for people to reduce the body weight, control the glucose, and also to avoid the complication. Because as a doctor, the most fearful complication for a person with diabetes or obesity is actually not death. It is developing cancers and also developing kidney disease requiring a dialysis or a renal transplantation, or a liver requiring a liver transplantation. These are all deadly complications of obesity and diabetes. But the message is these are all preventable, provided there is a routine, regular, structured follow-up, preferably including a telemedicine protocol. These are all preventable consequences.
Dr. Kapoor, when Professor Jyotidev speaks about monitoring, how often should Indians get screened for blood sugar and obesity related risks?
Right. So that would depend on the baseline risk. So if I have somebody who's got, both parents have diabetes and this person is having obesity, definitely every year would be the way to monitor the glucose level, even if the first time is normal. But yes, if the overall risk is low in terms of no family history of diabetes, the patient is physically fit and following good lifestyle, and then maybe, once in 3 years would be okay. So there's no one size that fits all. We may do more frequent screening for people at higher risk, less frequent screening for people at lower risk, but most important, screening for all.
Jyotidev, has India, won the battle against undernutrition only to enter and fight a new battle against obesity and diabetes? Because that's what is seen over the last couple of decades. Malnutrition issue has been stopped, but like the Prime Minister has emphasized time and again, obesity has become, a cause of concern.
I think the same can happen when we are trying to defend obesity, because when we are trying to reduce the body weight, there can be another challenge, and that is the challenge of losing the muscle. Because that we have to be very careful, because when you are treating diabetes, we are fearful of both high and low. So as you said, we need to be careful about the limits, both the upper and lower limit. So when you are treating obesity, we tell them that you need to retain the muscle, you have to have muscle strengthening, you have to have adequate protein. So when they are dieting also, many a time we have seen that they will go to the extremes of dieting. So that shouldn't be happening. So maybe when we are treating malnutrition, marasmus, and kwashiorkor in the past, we were not probably that careful, cautious. And that has probably led on to the epidemic or pandemic of overweight and obesity. But there are multiple other reasons, because we have gone through poverty, and that could have resulted in some thrifty gene and then shifting and all those hypotheses. But anyway, when we are tackling the current epidemic of obesity, we should be very careful not to lose the muscle. We have to retaining the muscle, but because muscle is a very, very important organ, even it is defined as an endocrine organ nowadays. So people should lose weight. And another important message from this discussion is obesity, if required, should be treated. And they shouldn't be stopping the medications. The earlier first generation drugs used to have so many side effects. The older drugs for obesity, they were having so many side effects in the heart, and some of them were producing cancer, some of them were producing depression and suicide. But the newer generation drugs are very safe and even approved for children, 12 years and older. So if there is an obesity which cannot be tackled, which cannot be treated with only diet and exercise, immediately go for treatment from an expert, because obesity, if left untreated, will lead on to more than 300 deadly illnesses, including cancer. So we are in an era where remedies are available and future complications can also be very efficiently prevented.
Right, Professor Jyoti Dev and Dr. Kapoor, thank you for joining us on this insightful conversation. And, the bottom line, Ahana, is the fact that, no amount of monitoring or enforcement or education or awareness will work if the attitude of the people doesn't change. So that is the need of the hour. Change your attitude, get yourself tested regularly, and do not ignore those warning signs.